You're welcome back to Morning Express. Let's set the ball rolling for the second leg of conversation on the program this morning. In the studio, we're being joined by Dr. Sunday Olatunde, who is a clinical pharmacist. And yesterday, while taking the newspaper review, we were speaking about the rising cost of medications in the country and individuals who continue to struggle and grapple with the purchase of medication that used to be quite affordable for them in Nigeria. Hopefully, Dr. Sunday Olatunde will give us insight into why this is so and perhaps proper solutions to Nigeria's woes in the healthcare system. A very good morning to you, Doctor. Thank you so much for finding the time to join us on the program.
Thank you very much for having me.
Well, first things first, it's no news that a lot of big pharma companies have exited the country in the last couple of years.
Yes.
Due to certain reasons that they have mentioned and analysts have also, indicated. And this has led to a spike, an unprecedented spike in the cost of drugs and medication in Nigeria. From your perspective as a clinical pharmacist, how would you assess the entire situation?
Well, thank you very much once again for having me on the program.
Yeah.
The issue with skyrocketing cost of medications is actually alarming.
Yeah.
It's something that disturbs everybody in the healthcare sector, and I want to believe that the larger society is more disturbed even than us. But you can easily take a look at it, considering some parameters that can influence the cost of medication.
Yeah.
We knew at a certain time that it was inevitable when there was a removal of fuel subsidy. Of course, we know that energy powers every economy.
Yeah.
When we talk of energy, you're talking of energy you derive from the fossil fuel, like a petrol, diesel, gas, and the rest of that. Then you still talk of electricity, and so on and so forth. And the floating of the naira was also another thing. Ever before, when naira was controlled and the government was paying the differential, you can put the cost of dollar to naira at a certain amount and project business projection, manufacturing projections, and the rest of all of that. But as soon as that was removed and all that, so it was inevitable that cost of medications will go up. So I think that's what I can say for now.
Well, in your practice, you deal with a lot of patients, I believe.
Yes.
You deal with a lot of people, whether affluential or well-to-do enough to purchase this medication, even if they are 10 times costlier. And then you have individuals who were already struggling with the low cost of the medication, and now with the high cost. How has it been like in the system? We know that the healthcare system is extremely broad. It's big. There are challenges in different quarters.
Yes.
But when it comes to accessibility and purchasability of this medication, how has it been like for the common man?
It's been extremely difficult for the common man. I must say to just answer that in a very simple sentence, and I can actually broaden that.
Well, please, we have all the time.
Okay, you see, what will contribute to the cost of medication? Like I said before, one, cost of energy; two, the demand and supply imbalance that we get when the big pharmaceutical companies exited Nigeria.
Yes.
The likes of GSK, the likes of Novartis, and all of that. They eventually left, and of course, there will be a kind of vacuum being created.
Certainly.
The demand for their products and similar products will be higher than the supply. That would definitely take the cost up. Apart from that is the movement of goods and services, which is now on the on the rise. Of course, when diesel went from almost 250, 350 per liter to about over 1,000 naira per liter, you'll expect the movement of goods and services to a kind of escalate.
Yeah.
So those are things that contributed. And of course, before, you can easily assess the foreign exchange and at a certain amount, 500 naira to $1, or even less at a certain time. But at the point where the government floated the naira, the cost of dollar went to about 1,500. In fact, at the time it was about 19 before it started coming down to about 1,520, 530 that we have now. That made the, you know, the cost of medicine to actually go up astronomically.
Yeah.
So these are issues. And as at that time, even the purchasing power of the people has not been increased, even up to today. 70,000 minimum wage cannot help anybody. Let's now take a look at common man. Yeah. When you talk of poverty benchmarking Nigeria, yeah, you know that it's not more than like 20% of the population that is above poverty level. If you take a study around that. Of course, even those who are at the middle class level, we are still grappling with this issue we are talking about, because our health insurance that is not covering significant number of the population is a big deal here. Because when you take a look at the policy direction of the country, of the government, which the subsidy has been removed, you will not see that the subsidy should come. When you look at the economic implication, you will also not see that the floating of the naira should not be done. However, what do we do to cushion this? Should be this thing. Yeah. So if health insurance is properly there in place and covers significant number of the population, you will know that an average person will not, you know, be dealing with paying out of pocket for healthcare services, especially medication. Yeah. In this case, what are people facing? A lot of people are resorting to alternatives. A lot of people are sorting. They are sorting
herbal medication.
Herbal medication, that's alternative medicine, yes, which they consider to be cheaper. However, there's a problem with that because of standardization. You have issues where you cannot control the standard of healthcare.
You can't also control the dosage and all
of that. You can't control all of that. You are not, the people practicing it are not under any regulation. So you may be weary of the standard you are getting there. And when you talk of standard, of course, when you take things that you are not supposed to take, more problems can be incurred, because you may be burdening the liver with something that you really cannot tell what you are consuming. The kidney may also be under pressure. So you have bigger problem even while you are trying to solve one. That's what we have seen in this situation. People are also, you know, taking cheaper alternative, even in the orthodox medicine that we practice. Cheaper alternative, which is also leading to reduced standard of, you know, healthcare services that they receive. That's on that side. On the other side of the professionals, professionals in many cases, we feel less than who we are. Yeah. When you want to go all out to solve a problem, and of course you see that your patient cannot afford it, yes, and what can you do? And when you even try to say, okay, let's do that for this particular patient, many more are still coming. So before you know, even yourself, the operational, you know, capital that you have to run your facilities and all that is going down. So in a way, we are all feeling it. The practitioners are feeling it, and the larger society, the members of the society are also equally feeling it. So
now there was a tax waiver that was, you know, given by the presidency, which is one particular point that a lot of people have, you know, hammered on the most, that was supposed to drop the prices of medication in the country. On the other hand, you had mentioned the devaluation of naira as one of the major causes of this spike.
Yes.
The government has devalued the naira. The government has also offered tax waivers for some, you know, medication in the country being imported into Nigeria. Is this the case of, you know, flogging a child and then also petting the child with another hand for the child not to cry? What are we looking at? Because if you look at both actions, they tend to contradict each other. Okay. When it comes to the purchase and importation of this medication.
Thank you very much. Not exactly.
Okay, please. Your own point.
It's not exactly. You see, when naira was devalued by the floating of naira to dollar, and the subsidy removed, that was done generally.
Yes.
But in order to cushion the, you know, attendant effect of all these policies, government now narrowed down, you know, some certain specific essential areas, yes, where they know that if subsidy is not given, or a kind of rebate is not given to people, life may be much more difficult. Yeah, it's a kind of, I can understand the economic policy that the government is trying to pursue and the way it's trying to go about it. Yeah. But I must clarify some things about the executive order. You know, that executive order was given around, I think it was around August last year, 2024.
Almost a year now.
Yes, and that executive order, thank God, I was in one of the sister stations to speak to that executive order.
Yeah.
The executive order actually removed tariff and excise duty from pharmaceutical raw materials, not products.
Oh, okay.
Pharmaceutical raw material. As at that time, it was pharmaceutical raw materials. And this is intending to actually make a local production of medicine to be competitive. Because we know that we bring a lot of medicines from outside as a matter of a kind of importation.
Yeah.
And you want to give a kind of power to local manufacturers so that they can be at a competitive, they can have competitive edge, so that they too can be stable and some of the medicines they produce can be affordable here. But the problem is, number one, that particular executive order was not gazetted early. The operation of it started around March 26th of this year. You can see that March 26th of this year. That's a kind of you will not be feeling the effect of it by now. Because when you talk of March to August, you are just talking of 5 months. 5 months. May I tell you that pharmaceutical manufacturers or importers or those who are into contract manufacturing, they project ahead. The medicines that are on the shelf this year will be produced last year. They will retrospectively look at their consumption pattern the year before last year, the previous year, project for this year, and bid for manufacturing of that quantity or with a little overage for this year. So as at the time you are talking of that executive order, people have already made order for this year. Therefore, what you have here will still be as constant as you used to have it.
Even in terms of pricing?
Even in terms of pricing, because they have manufactured before the executive order came now.
Okay. So what is your own projection? When should Nigerians begin to see the effect of this executive order that has taken off some sort of tax waiver of these raw pharmaceutical materials that are being imported into the country for production? Okay.
When I was invited to that station that time, I gave the country about 2 years. Yeah. That's when you can start getting a kind of
2 years from now, or 2 years from the time the executive order was given.
The 2 years to the time when the executive order was given. Okay. Because but we can also, it's not only that. Let's take a look at how much of medicines do we produce in Nigeria? Because even if the executive order takes effect, how much of medicine the medicines we make in Nigeria, they are not more than like 30% of our national consumption. Yeah. So in that case, that means that you still leave about 70% that we import, whose prices will still be dependent on the exchange rate and the cost of transportation. So even when that happens, when the executive order takes effect fully and you are feeling the impact, you only expect that about 30% of our consumption will only be affected. Others that we don't have capacity to produce may still be at that level of price that we feel is high for now. However, what can government do concerning that? We should expedite action on health insurance. Because when it's either you give subsidy, as you have, okay, let me put it this way. As the government has signed a executive order to remove excise duty and tariff on pharmaceutical raw materials, it can as well extend it to finished pharmaceutical products. Products are different from raw materials. Raw materials are used to make pharmaceutical products here in Nigeria. But the finished product that we import, if the government can also kind of declare a waiver or a kind of removal of tariffs, removal of excise duty from them, at least about 20 to 30% of the cost of such medicine will go down. Then government can as well take a look at, apart from health insurance, apart from waiver for tariffs and excise duty, government can target a kind of fund for those who are into contract manufacturing, those who are into importation of medicine, and those who are manufacturing locally.
Now these are policies that you think the government can adopt in order to regulate the system and ensure accessibility of these products, pharmaceutical products, to patients in the country. We will get to that in just a moment. Earlier, I had asked how the prices of the high prices of drugs are affecting patients.
Yes.
But we are also forgetting about one thing:
Okay.
the businesses themselves,
Yes.
the pharmacies that operate these businesses who sell the drugs to patients, even though the drugs are expensive. They still have to buy these drugs, maybe the 30% locally manufactured and the 70%, imported, still have to sell them. How has that been like? I don't know whether you have a pharmacy or not, but I'm sure you have your colleagues who do.
Yes.
So how has that been like for you people on the business side?
Thank you very much. That's a very genuine question.
Yeah.
Let me take it this way. There was a time I was working for a pharmaceutical outlet, a big chain for that matter. And most of the products we were dealing in were actually imported from UK, United States, and all of that.
Yeah.
I won't deceive you. Around the 2016, 2017, that company actually ran down. Okay, why? The products were largely dependent, or the chefs were largely dependent on imported products. And during that time, President Buhari actually devalued Naira. And you imagine a situation where the last purchase you made was 500 Naira, and you put a markup and you sell it for 600 Naira. And by the time you want to go and buy the new one, after devaluation of Naira, the cost price is now 900 Naira. You can see the differential of 300 Naira.
Yes.
If you have a bank facility, you may need to approach bank to borrow money to fill in that gap. If you don't have that kind of facility, or you don't have collateral to you, of course, the interest rate and all of that.
And then the weight now falls back entirely on the end user.
Yes,
the patients.
Not only the end user, the company may also run down because of that. Of course, because you cannot no longer procure your products to put on the shelf.
Unless in the instance where you have a bank facility.
When you have a bank, of course, we know our facility says with very high interest rate. So if you get such facility, you pass it to the end user. The end user is going to grapple with a lot of price increases and all of that. But for the business, for those who may not have that kind of facility, that business actually went down. Like I was telling you, they couldn't operate that company as we speak now because of that singular reason. Also, those who manage to stay in business will have to go for cheaper alternative medicine, not considering the quality or whatever, because they want to keep being in business. Since you cannot afford the one that is a bit higher in terms of cost, you have to stay with the one that your money can buy and put it on the shelf for the patient. So we can be getting lower healthcare lower quality in terms of delivery, and that is not too good for anybody.
Now I understand you are a clinical pharmacist,
Yes.
Dr. Olatunde, and most times pharmacists don't really agree too well with these alternative forms of medicine, the herbs and all that, even though there are some people who believe it works for them, right? In instances where we have these people who are gifted in the art of producing the alternative medicine, is there a way that there could be some sort of collaboration, maybe with the organization responsible for pharmacists in Nigeria, NAFDAC getting involved, the Ministry of Health getting involved, and then the Association of Tradomedical Practitioners, to ensure that in as much as individuals still go for pharmaceutical medicine, they can also comfortably and confidently access these trado medicines to treat certain ailments that might not be life-threatening or too critical.
Thank you very much. That's also quite important.
Okay.
There is no pharmacist that is alien to alternative practices.
Interesting.
In fact, when you get to every school of pharmacy, or the one you can call Faculty of Pharmacy in Nigeria, about 6 or 7 departments that make that faculty. One is called pharmacognosy, and in that pharmacognosy, what we do is to explore medicines in the alternative way, either from plants, from animals, or from natural resources. And that is what alternative medicine, practitioners do actually, except for those who are not into, product production, like those in, let's say, bone setting. Those one may not be into product production. It's just a kind of skill to set bones and many other words. But pharmacists are not naturally alien to alternative medicine practice. In fact, you are introduced to the ones that are not native to Nigeria, like acupuncture and the rest of all of those ones that are into China and all those Indian alternative medicine. We are quite aware. The problem here is subjecting this to standardization. Because you see, as you see pharmacy practice, pharmacists don't just practice. Pharmacists are regulated by agency of federal government through the Federal Ministry of Health. Pharmacy Council of Nigeria regulates the practice of pharmacy and pharmacists themselves and keep register of all pharmacists. So there is no pharmacist in Nigeria that the Pharmacy Council of Nigeria does not know. Know where he lives, know where he's working,
at all.
Anywhere in Nigeria. And they are also in connection with Pharmacy Council of all countries all over the world. I could remember at a time when I needed to register with the Pharmacy Council of Canada. Yes, the Pharmacy Council here had to link up to send my letter of good standing to Pharmacy Council of Canada. The same thing I did with Namibia. Yes, they also sent letter of good standing from here to Pharmacy Council of Namibia. For you to know that standardization is the problem. You know, a situation where before you see every medicine on the shelf, orthodox medicine for the that's medication on the shelf, it has passed through clinical trials.
Series of clinical
trials. So the question is, where there's no standardization, no dosing that is standardized, no clinical trial to prove, the whole world, all of us cannot rely on observation of one person inside one room to claim that this medicine can do this, can do that, and nobody has subjected it to trial to see that whether that claim is actually valid or not. And that's where we have problem. That's where we always kind of exercise some level of restraint before
concerning the unorthodox
medicine. But if it could be subjected, if Federal Ministry of Health can take that responsibility with NAFDAC and to the there's a certain agency that is also into alternative medicine and all of that standardization in Nigeria. I think that agency is in Ministry of Science. And
but Dr. Olatunde, let's talk about the reality of Nigerians.
Yes.
From time immemorial. For example, something like agbojedi. A child is sick, agbojedi. A child is purging, agbojedi. You have headache, it's the same thing.
Yes.
Back pain is the same thing. And somehow, the belief is that it works because people have seen it work for them.
Yes, you are correct. That's the reality of Nigeria. But seen it, observed, they only observe that it works.
Yeah.
These are issues. When you observe that a certain medicine works, what gives you that validation? I've seen situations where, even in orthodox practice, that people feel a certain medicine works for them. Take, for example, a person has cold and catarrh and is feeling feverish because of that cold, the cold viruses. And he goes ahead to pick, let's say, chlorpheniramine, Piriton. Because that particular situation he has is self-limiting. That situation will go on its own. It's a matter of time. The immunity of the person will take care of the cold viruses. But during the time when he starts either vitamin, let's say vitamin C or chlorpheniramine, that is when the sickness goes. He will come with a conclusion that what cures him is the medication. So in that case, we have it in those the unorthodox practice too. Because not only also on what a medicine does, also about what a medicine can cause.
Side effects.
No, side effects may not even be dangerous.
Okay.
There was a time
when you say
let me quickly explain this. There was a time you had that there's a medicine for HIV that it could cure HIV. And in putting it together, that medicine has some activities to inhibit the virus causing HIV. But that medicine is not safe for the liver and kidney. So when you have not tested a medicine against whether it can cause any other dangerous effects, you really cannot say somebody should go. Even when it's able to cure the problem, it can as well cause other problem. And we must subject such product to standardization to be able to know that it cannot cause that. I could remember while I was graduating from University of Benin, my first degree was Doctor of Pharmacy program. What I did was to try a certain drug inside the mushroom
Yes.
against whether it is poisonous to human consumption or not. And I used guinea pig that I went to University of Ibadan to buy to do that, in order to just know. It's not only to take a medicine, but to also ascertain that this medicine is not dangerous in another way. So that's the problem with alternative medicine. We want to know that this medicine is not dangerous. And that's...
Well, let's talk about the certain medications that are, if not taken, could be life-threatening.
Yes.
Diabetes medication, malaria medication, medication for say asthma patients and all of that.
Yes.
Medication for ulcer patients. These are health conditions that, if not properly managed or treated, could be life-threatening. As little as malaria is, or
Yes,
as little
yes,
as people
yes.
think malaria is,
That's true.
it is life-threatening.
Yes.
Is there a way that, out of all of these policies that you had outlined, which we'll still get back to, there could be some sort of regulation on the prices, or some sort of subsidy now on the prices of certain medications, in order to help people with these conditions to be able to access them easily?
Yes, we started talking about what the government could do the other time.
Yeah.
Number one is to make sure the health insurance covers greater percentage of Nigerian population.
Yeah.
When there's no fear of whether I will pay out of pocket
Yes.
or not, people will feel free to access healthcare facility anytime, any day when it happens, because sicknesses actually don't write letter before they come, and they can meet you at the time when you are broke.
Yeah.
Yet you still need to treat yourself. Health insurance is very important. Two is the removal of some certain taxes,
Yes.
such as tariffs, such as excise duty from pharmaceutical products, finished and raw material, so that one, you can enhance the local production. Two, the ones that are coming can be affordable for the patient. So if the government can take a look at that, if the government can get financial facility, capital, somewhere where manufacturers, drug importers, contract manufacturers also can go to source loan at a very cheap interest rate, that would be very good.
Yeah.
Because if the interest rate is too high, with the one we have in our commercial banks these days,
That's what now hits the company. Most companies who are not strong enough shut down.
That's it. More is that you see the policy being driven by CNG, the CNG initiative that the president, the government is driving, is also very important. If you can make this CNG to be much more available than it is now,
Yeah.
all our articulated vehicles that are into transporting, products can switch to CNG. When they switch to CNG, like Dangote is trying to do,
Yeah.
you will see that the cost of moving products from one place to another will go down, and the cost of services too, that's moving services from one place to another, will go down. When that happens, then let there be electricity. Let there be electricity. I tell you that even band A is not as expensive as using diesel to power a manufacturing outlet. So if there is electricity, then people will be able to manufacture at a cheaper rate. Then you'll be able to give to the public. There's nothing government can do more than that, because government cannot continue to still pay direct subsidy on products again. If you do that, that will not. Even Nigeria, a lot of unscrupulous, businessmen and women will still take advantage of that and still be draining the government. But if they can make electricity happen, and the CNG is made available, that articulated vehicles that move products switch to CNG, and if health insurance covers all of us, and that if taxes like tariff and excise duties are removed from both imported raw materials and finished products of pharmaceutical origins, that will make medicines to be more affordable and available to the teeming population.
Now, Dr. Olatunde, while we also, address the issues of high cost of medication and why these medicines are becoming more and more expensive by the day, and also trying to, foster a viable pathway to affordability.
Yes.
Let's also talk about ways that individuals living with certain health conditions can also help themselves. If you don't have the money to readily purchase these drugs, at random, then you should be able to have some maybe lifestyle changes, or some precautionary measures to ensure that you either don't have an attack or you don't have an episode or whatever it is. What is your own assertion to this matter?
Yes, yes, thank you. That falls under the purview of health education,
Yes.
counseling, and health education. Essentially, let the teeming populace patronize professionals. Some tips are given all throughout last night.
Yes.
I was in counseling sessions with patients, giving them tips and how they can assess health. And some of the things that you tell them, they are very cheap, they are very, readily available, and they can save life.
Yeah.
It can save a lot of money. It can save so much. First and foremost, make sure you identify qualified, knowledgeable healthcare professionals that you patronize. Okay. Apart from that, yourself, be interested. Choose to be healthy. Because where people don't choose to be healthy and priorities, because in the course of practice, I've practiced for about 15 years now.
Yeah.
In the course of my practice, I could see that the priorities of a lot of people is not in having quality health.
And why do you think that is so?
They put their priorities on other things. For example, as a human being, you have a car,
Yeah.
you have clothing, you have other things, and you have your body, your health to take care of. Which one do you give more priority?
Most people will service their cars
They
almost
service
every
their
month.
that's the truth. They service the car, they drive a big engine one, they put all of that together to make sure the car is good, but never think about the body that works to make the money to buy the car.
I think I have a confession, Dr. Olatunde.
Yes,
I might be part of the people who don't necessarily prioritize, taking care of their bodies as much as they take care of
those
their
other
cars.
things that are not so important.
And this also goes to show that items like dietary supplements and all of that, I mean, they don't necessarily come cheap, but in comparative analysis to how much you spend on your car, how much you spend on other items, it is cheaper to maintain your body than to maintain other things.
That's just the truth. So I've seen that over and over when I observe the way people live their lives. There was a patient I was managing his blood pressure at a time, and he will complain and complain and complain about the cost of the medication. This medication is not up to 10,000 naira in a month, but he was driving a Venza.
Yes.
And I know what could make you to maintain a Venza per month in terms of fueling, in terms of maintenance,
servicing
and all of that. So, but he will complain many times he wouldn't buy his medicine. This is a BP medicine that you must be on.
Yeah.
Many times he won't buy his medicine because of saying there's no money. But he runs this car every day. So, if you choose to drive a smaller car so that you can have money to maintain your health, because it is the body that works for you to make money to maintain the car.
Yes.
But if you don't put priority on the body, then you will have missed it. So also some people put priorities on the house they live, but they are not ready to put priority on the health.
Body.
Some put priorities on the clothes they put on.
Yeah.
They go for the best quality clothing. But if it comes to taking care of their health, they put it as secondary. So we must prioritize appropriately. We must know that this body needs to be cared for, and we must care for it. So that's the advice I would like to give to the teeming populace. They need to take their health very serious, because it helps the country.
Yeah,
it helps the country.
Well, let's also take you back a little bit to the locally produced drugs. You had given us a ratio of 30 to 70%. 30% locally produced, 70% imported. You have also analyzed the case of the tax waiver on some raw materials being imported into the country. But how about the local manufacturers in Nigeria? In terms of scaling up this production, in terms of opening up a level playing ground for these manufacturers to be able to do business easily, produce more, crash the prices of these pharmaceutical products, and open up more affordable products to individuals in the market. Is there a role that maybe the government has to play, and what role does the Pharmacy Council of Nigeria also have to play?
Okay, thank you. Thank you so much. The government is quite proactive.
Yeah.
I must tell you that, and that's what the executive order stands to achieve. It wants to make the local manufacturing competitive. That the local manufacturers can produce at the cheapest possible costs. And by that, their home product will be cheaper than the imported one. So the imported one will not be able to compete with them. If the imported one cannot compete with them, they will be able to have a market share that can give them sufficient profit for them to expand their production. You know, in pharmaceutical production, you have a production line. Let's say the entire, a particular outlet is producing just 6 products.
Yes.
But when you have made good money from that 6 products, you can expand to make it 10 products.
10 products.
And from 10, you can expand to 15 products. Like that, like that. And the formulation, the good manufacturing practice you need to adhere to can also be scaled up. If you take a look at products like paracetamol, you will see it in the form of normal paracetamol, in the form of Panadol, in the form of... They have little differences because of scaling of manufacturing, practice around.
So you have more options to choose from.
With that, you'll be able to expand. So the executive order is meant to address all of that so that they can have a competitive edge, they can increase their, their profits, and they can expand and make Nigeria to be self-sufficient in pharmaceuticals. So the government is doing something great, I think, in that direction. It's just that we need to give the policy some time before we can start getting the benefits from it.
You had earlier mentioned there was an analysis you gave of pharmaceutical product producers projecting a year ahead producing this product. And you mentioned that from the time the executive order was given, we should give the executive order, we should give Nigerians, we should give the Nigerian government and manufacturers 2 years for this to take effect. What is your own projection for medications like insulin? What is your projection for medications, malaria products? What is your projection for what is it called now? The inhalers for asthma patients. Beyond crashing the prices, are there initiatives that can be taken to give individuals, maybe in rural communities, better access to these products for a better health life?
Oh, thank you so much. You see, as you mentioned those products, some of them fall within the purview of what can be manufactured here.
Okay.
Some, the sophistication of manufacturing that brings them to bear, or that brings them on the shelf, is not yet been attained by our local manufacturers. If you take a look at the asthma inhalers and all that, I think at the time Evans was doing something like that. But later, I don't know whether they are still producing it, but a lot of local manufacturers don't have the sophistication to produce some certain medicine. Like insulin you are talking about. Some of them really don't still have the sophistication that it needs. So
people would rather purchase the imported ones?
Yes, but for the anti-malaria, a lot of our local manufacturers are making anti-malarias. So for those that fall within our own purview, what we can manufacture, because that's what the executive order is to address. When the companies are able to make their products, they have the market share, they are able to make profit, they can then invest in other areas where we are not sophisticated enough to produce some certain products. They can invest like that. So I think going by the question you just asked about the manufacturers, what can they do?
Manufacturers, healthcare providers,
and all that.
Clinical pharmacists like yourself, doctors, the entire healthcare system in Nigeria. What can be done to ensure easy access for individuals, vulnerable people in rural communities, in places where it's not easy to gain access to these healthcare services? I'm talking about campaigns. I'm talking about maybe humanitarian outreaches and all of that. Are there any ones that you are aware of? And from your perspective, what can be done better to reach these individuals?
Yes, there are campaigns going on. There are non-governmental organizations that are taking campaigns to some certain places. What the government can do better, because this is actually is a buck that should stop on the table of the government is that primary health care system must be paid attention to. The government also must reprioritize. I thought of this while coming to the studio this morning. You know, we, like in Abuja here, we're developing road infrastructure and all that. Healthcare, education, and security are almost neglected. And you know, for every country to be categorized as a developed country, your human development index must be high and must be tight. And how you get a high or tight human development index is in healthcare, is in education, and it's in security. But if you don't have all of that, you pay attention to road and all that. I don't know who you are tarring the road for. This for me to call the attention of every concerned individual, including the FCT minister, to pay attention to healthcare. Where population is growing, healthcare facilities are not increasing. You know, education facilities are not increasing. Why the population is growing? Primary healthcare needs to be paid attention to. I know that primary healthcare are largely in the hand of you know, local governments and all that. They should allow local government to function so that they can invest in primary healthcare. You know, with primary healthcare, you have like a center, maybe for every 1,000 population or something like that. Okay, if you have such a center, from that center, you'll be reaching out to the population in terms of health education, in terms of making medication such as insulin, such as asthmatic inhalers and all of that available to the community. Then they should also invest in dispensaries. I don't know why governments cannot invest in dispensaries. You know, we are not talking of Abuja. An Abuja dweller and the people in Abuja can afford to go to pharmacies and all that. But when you get to the interiors and the interlands, where people are not even educated enough to manipulate their medicine. Of course, when you take a asthmatic inhaler to some certain places in Nigeria, an individual there, because of their literacy level, could not even pick the inhaler, read the leaflet, and manipulate it and understand it. So in such situation, people in those areas, the primary health care that exists there will be able to provide this education to people and guide people on how to live a healthy life. But a situation where primary health care system has largely collapsed in Nigeria, because if you go to the interlands, go to villages, how many of it do you see that are functional? I think government at federal level and state level should help local government to be able to invest in this. And the one that is the responsibility of federal government, they should take it very serious and let primary health care function. If primary health care function, secondary health care will not be burdened. Or all those general hospitals and all that. Many of the cases they are dealing with are cases that should be taken care of at the primary health care level. And sometimes even when you go to tertiary system, tertiary facilities, such as National Hospital, Abuja Teaching Hospital, Federal Medical Center, and all of that, you see cases that ought to have been taken care of at primary health care level, being brought to all these specialized centers. And that's not supposed to be. So we burden facilities unnecessarily. So government should invest in primary health care. If that happens, we'll be able to reach the interlands and people will be healthier. And a healthy citizenry will actually promote a healthy economy. Because if you don't have citizenries that are healthy, the macro
economy would also suffer.
Is going to suffer, definitely.
Well, we have just about a little under 10 minutes to wrap up this conversation.
Okay,
it's been quite informative from you, Dr. Olatunde.
Yes.
But how do we also balance pharmaceutical businesses, which you are also a part of, you know, the pharmaceutical business sustainability, with the right of patients to access quality healthcare?
Thank you very much. Thank you very much. The pharmaceutical business is a business. We cannot shy away from the fact that it's a business, because if you don't see it as a business, it cannot sustain itself.
That's true.
Okay. At the same time, we must know that patients deserve the right to quality healthcare. The only person that should come in between the patients and the professionals is the government. The government should look at areas where business interest wants to override public health interest and try to work around that. If that is properly identified, where subsidy needs to be given, we give. Where SSD2 needs to be removed, we remove. Where practitioners needs to be trained, they are trained. So all of that will make the public to benefit maximally from quality healthcare services from the country. But if that is not done, and the government looks the other way from all of that, the general public will be suffering. But may I tell you that when we say general public, the healthcare professionals are not exempted.
They are also part of the
Because,
general public.
yes, more often than not, we also assess the facility that we provide. Because nobody carries a stone body that does not get sick. So all of us are victims, and it will not be good that we are all victims. Government should play its role properly.
A vital role in creating that enabling environment for businesses to thrive,
yes,
while also not trumping the right of the patients to affordable healthcare.
That's true.
There was an issue that I think we had skipped over a little bit during the course of our conversation, and that is the issue of health insurance.
Yes.
Whether government backed or privately owned HMOs.
Yes.
In terms of accessibility to affordable healthcare, these health insurance schemes tend to help out a lot, but not a lot of Nigerians know about it. Not a lot of Nigerians know how to go about it. Not a lot of Nigerians have easy access to these healthcare insurance schemes. Can you give us a breakdown of how to go about it, whether government backed as a civil servant or privately owned for private individuals?
Okay, let me come this way. The challenge this country has got is we operate a very, very large and massive informal economy.
Yeah.
Where which a lot of jobs that are available in Nigeria are not captured, and a lot of people that do businesses and all that are not known, and the businesses are not registered. Yeah. And as a result, if you want to bring people into this net of or this bracket in health insurance, it becomes difficult. But there's nothing too difficult that we cannot crack our brain and solve. At the level of local government, people should understand that government should help people to do what we call a crowdfunding. Farmers can be helped through the religious leaders and traditional rulers to know that they need to have a contribution every month. Because if you say government should provide free health care, it will not be sustainable in this reality of our Nigeria of today.
The Nigerian setting.
So, but for people to pay little amount of money, 1,000 per month or 2,000 naira per month per individual, the government of every local government can coordinate that community by community so that they can access healthcare. So health insurance is the way to go. We have been having challenges of the health insurance not going beyond I don't know which percentage of the population we have covered now. At the time it was 4%, later it scaled to 8%. Like that, I don't know where we are, whether we are 16% or something. But that's still a far cry from where we ought to be. But I can see that there is a certain percentage of the population in the hinterland who cannot easily be brought into. So local government should be able to work around that, put people into crowdfunding, get them to pay every month small amount of money, which can be enough to take care of the few sick
when you
ones.
say crowdfunding, can you sort of break that down a little bit more? Because are these people going to gather these monies themselves and register as a group, in the HMO or in the NHIS or whatever it is? Or are they going to remit the money to the local government council? Are they going to remit the money to what exactly? How can they go about it in very simple terms?
Okay.
I believe our viewers would want to know.
Yes, you are very correct. You see, what do you call the health maintenance organization?
Yeah.
People who receive money, assuming that those who pay to them, assume that their employees will be sick, but not all of them will be sick. But will they pay for everybody?
They pay for everybody.
So the HMO has the bulk money and sort out little or individuals that are sick. It may not be up to 10% of people they pay for per month that they do that.
Yes.
An HMO is just like a kind of a middle person who collects the fund and who pays
channels to the hospital
and all that. So at every community being manned by the government, that can be done. If a farmer pays 1,000 per month and all farmers and their wives and the children pay 1,000 in a month, and the government becomes a custodian, that's by opening an account somewhere or using an HMO where the government now pay that money to, and those people can go to access healthcare facility. That's just
free of charge.
Free of charge. It may not be as formalized as the health insurance.
As the health
but
insurance
that's what I'm
scheme.
calling crowdfunding. People just come together.
And this can work best for rural settings.
Rural settings. That's what I'm saying.
Where the primary healthcare system is gradually fading away.
It's gradually fading out.